Okay, thank you all so much for joining us today at the first annual Diapoint virtual picnic. As many of you know, we're doing this virtually because we originally had this scheduled back in March before COVID. And then COVID came to town, we said we would postpone. And here we are still, unsure of when we should do large scale events again. So I thought, what better time to do this than now? My name is Pamela Durant. I'm the founder and managing director of Diapoint ME, the place for people touched by diabetes. And I am so very excited that today Dr. Madiha Khan has agreed to join us to talk about the psychology of a chronic condition, the psychology of diabetes, which is so very important because, as most of us on this call know, that this condition is not only is it physical and physiological, but it is so much of a huge psychological challenge as well. And so we're very happy that she's joining us today. Dr. Madiha Khan, she's an American board certified psychiatrist. She specializes in general adult psychiatry, and she completed her medical training from Baylor College of Medicine, which is in Houston, Texas, in the United States. After her residency, she continued to work with Baylor as an assistant professor of psychiatry, and while practicing outpatient psychiatry at a county clinic, she also maintained a private practice in the US before she relocated here to the UAE. So thank you, Dr. Madiha Khan, for joining us. It's really such a pleasure to have you today. Your background and experience is really wonderful, and please let me know if there's anything that I've missed that you'd like to share with us before we begin.
Thank you so much for the wonderful introduction, Pamela. And I feel very grateful to be here today. Thank you for inviting me to speak about this very important topic. And I say very important because of the nature of the relationship between chronic illness like type 1 diabetes and emotional and mental health issues that can be associated with it. And the nature of the relationship is such that whenever somebody has a physical illness, and especially if it's a prolonged illness or a serious illness, there is bound to be stress associated with it, right? And once you start feeling the stress, or if it becomes something deeper like a depression or anxiety, chances are that the patient's treatment or the outcome of the disease will be affected by those emotional factors, right? So if somebody starts feeling depressed, or if they're so stressed that they stop taking care of themselves, stop taking their treatment the way they're supposed to, stop being compliant with whatever needs to be done, their diet, their exercising, the medications they're supposed to be taking, the way they're supposed to be monitoring their blood sugars and taking insulin or using the pump, whatever needs to be done, if the stress or depression comes in the way of that, then obviously the outcomes of the treatment will be affected, the disease progression will be affected. So it really becomes, at some point, it becomes a vicious cycle. One factor making the other one worse. Physically, if you start feeling worse, then of course your emotional well-being will be affected even more, and so on and so forth. So I think it's really very important that we take into account how much of these psychological factors and the emotional well-being of the patient can affect the physical illness in itself, the treatment outcomes, and how a person overall feels. And it's, I'm really happy that we're talking about this here today, because some of these things, people who go through them, they know them, they experience them, but it's not talked about enough. And because of that, there's a reluctance to come forward and say that, yes, this is stressful, not just for the patients, but for the parents, for the caregivers. It just becomes so stressful, and there's this reluctance and hesitation to talk about them, because what if people judge you? What if people judge you for being the kind of parent who can't handle their child's type 1 diabetes, you know? So I think it's really important that we all openly talk about these things, and I'm very happy to be here today to talk about them.
Thank you so much. And thank you again for everyone that's joined. I think we all agree this is an extremely important subject for all the reasons that you've highlighted. And please, if those that are attending, if you have any questions, feel free to write them in the chat. At the end of our discussion, we will get to as many questions as we possibly can. But I think the best place to start with this discussion is from the beginning. when there is a diabetes diagnosis in the family, it's incredibly difficult, regardless of the type of diabetes, but particularly when it's a child with type 1. Not only can it be stressful for the child, but also for the parents. It's a shock. We typically do not know anything about type 1 diabetes until we're presented with a diagnosis. There's a lot of grief, anger, probably other emotions and things happening. So could you kind of help us break that down and, give us some advice? Typically, how should we be dealing with that, or what can one do? There's a lot of people on here that are experiencing this right now, and even not in the time of newly diagnosis, sometimes those feelings can come up again. So how can we work toward really accepting this to manage it?
Mm-hmm. Yeah, I think that's absolutely a very important question. So when parents first hear about this diagnosis, a lot of times, like you said, parents don't even know what it means, right? A lot of us haven't even heard about type 1 diabetes. Yes, diabetes, everybody knows, but how is it different from type 2 diabetes, which is much more common? Um, so finding out what all this is, then wondering why your child has become afflicted with this condition, knowing that it's in most cases a lifelong condition, and sort of coming to terms with that can be very difficult. And it's when parents experience this, they almost go through this concept of grief. Like we've kind of heard about the stages of grief, the terms that are associated with that. At first, being in denial, not wanting to accept that this has happened, or using coping strategies to stay in denial, feeling like, no, somehow, this will go away by itself. Maybe if I don't think too much about it, if something happens, if I find some doctor, maybe they'll tell me that it's not really type 1 diabetes, it's something else. So you're hoping against hope that your child doesn't really have this condition, right? So dealing with that denial, then anger, maybe frustration, resentment, even feeling guilty, wondering if you have done something for your child to be going through this, right? Really, parents go through all these different feelings. Then comes the stage of bargaining, where you're trying maybe alternate techniques, hoping for some miraculous or magical cure out there. You're talking to people about herbs and whatnot, figuring out if something can just work to cure your child. You want a magical cure, right? Just to make this thing go away. And then finally, when you feel like, this is it, kind of depression hitting, right? Feeling like, oh my God, all the hopes and dreams I had for my child, maybe, this could come in the way of that. Because what every parent wants for their child, with no exception, would be happiness and good health. And feeling like that of contentment is maybe now somehow being affected by this diagnosis that you have to deal with. There can be a sense of depression, a sense of loss of normalcy. You think about your child's future, and you have this feeling of doom and gloom, what's going to happen. So living with all that, and then finally accepting and figuring out what to do, right? How do you get help? Where do you find the best endocrinologist, the best dietitian, a diabetes educator, somebody who knows about all this? So then going in the phase where you are struggling to get the best kind of help for your child. I think, Pamela, you asked me how we can better deal with it. I think really the first step is knowing that all this will probably happen, right? And being kind to yourself, being empathic to yourself, and knowing that you are going to go through most of these stages, not necessarily in the same order, but there will be most of these phases. And even after acceptance comes, it's not like that's the final stage and now you're all prepared and set for this. These stages will keep on coming, one after the other, over and over again. Maybe at some point there will be again some denial. Maybe there will be again some bargaining, some depression, right? Some resentment and frustration. So I think it's very important to be kind to yourself. I think it's very important to get support from people, from friends, family, talking about this, doing exactly what we're doing right here, right now, forming support groups where people can feel comfortable to reach out and talk to each other. And basically knowing that that this is not easy, right? Not feeling the guilt, not feeling like in some way you're being a bad parent by feeling burdened by all this, because it's very difficult to deal with any chronic condition, any disability for a child, right? So really being kind to yourself, I think, is of the utmost importance.
Yeah, great. Thank you for that. I think what you described in the cycle is exactly, I was like, oh yes, and I lived that, and I lived that, and I did that too. I did all of it, absolutely all of it. And then just kind of when you think you're past it, you do go back into it. It's almost like I call it a roller coaster, because sometimes there's those loops and dips, and they are so scary. It's not just the beautiful rolling hill that we see in the graph. And so that is kind of, from a parent perspective, that's our reaction. My son was really young. He was 20 months old, so he really didn't know what was going on. He has no recollection of that, and so I don't think he deals with the psychological challenges that, say, a child at an older age, or even some young adults and older adults, are getting diagnosed with type 1 diabetes. Can you speak a little bit to what's happening with our children or a young adult at the same time when they're diagnosed?
Right, right. I think what happens is, like you said, when a child is very young, and children can be diagnosed when they're infants, when they're toddlers, it really doesn't hit them that way. They become used to this idea of living with the monitoring, living with some kind of restrictions. At some point, though, it might still again hit them when they reach teenage, when they have a deeper understanding of identity and what it means for them to be a child living with type 1 diabetes. They still might go through those feelings, and of course, a child who has always lived a very different kind of life, for them to be diagnosed and then experience a very big change in their lives, they will have a very difficult emotional reaction to the acceptance, right? So for children, I think, again, they could go through these stages of grief. They could have feelings of anger, feelings of resentment towards life, towards if they believe in a higher power, kind of wondering why it had to happen to them, right? I think another very important thing that they face is the identity challenge. So what does it mean for them? Would they be able to fit in with the rest of their peers? Would people think of them differently? Are they weird? Are they strange? Are they someone that they should be ashamed of, right? Also wondering what's going on in the minds of their parents. Do their parents feel proud of them, or are they ashamed of them for having this illness? Do they feel that their parents are hiding their illness from other people? Do they feel like they have to keep it a secret? Not knowing how to even maybe communicate to their friends or peers about it, because if we feel that adults don't know, there isn't much awareness about type 1 diabetes, then in children, of course, there's much, much less. So where do they begin from? When they start telling their peers about diabetes, their peers might have heard of their aunts or uncles or grandmothers having diabetes, but they don't know what type 1 diabetes is. And they'd be like, hey, you're being too dramatic. We know so-and-so who has diabetes and they're fine and they're living a normal life. Why do you have to carry this device with you everywhere? Why are your parents so kind of particular about not letting you go for sleepovers or out of town trips? And, what is all this drama? They might not say, they might sort of imply it. And for children to deal with all that stress can be very, very difficult. For children to also feel like when their parents are stressed, for children, everything revolves around them, right? Their identity is very central. So anything happening in the world would be about them. So if they feel like their parents are stressed, if they are frustrated or angry about something, is it because of my type 1 diabetes? Is it because my parents, see me as a burden? They'll have all those questions. If parents are having marital conflict, children might blame themselves about it, right? So I think all those feelings are very normal in children. And at some point, the responsibility that they have to live with, taking care of themselves, making sure that they don't get sicker than they are, they don't get complications, their blood sugars don't go off the charts. sometimes it's easy, it can be maintained, but at times children just become so tired of this responsibility because it's never ending. And at some point, they might start thinking, well, I'm done with this. I don't want to take care of myself, right? They stop taking care of themselves. It almost becomes a part of, and usually this happens in teenage or maybe for young adults where they want to give up. And dealing with that, keeping them encouraged and motivated, it can be difficult for the parents as well. And we're talking about what happens to children, what happens to adults, the parents who are taking care of them, but really it's an intertwined cycle, because the relationship between a parent and a child is such that they're both going to be affecting each other constantly. So if a child is going through stress, then chances are that the parent will also feel stressed, and vice versa. So I think all these things are so interconnected. The dynamics of what happens in a family, it's so interconnected that all aspects have to be always taken into account. And coming back to the parents, for them to feel like, we talked about marital conflict a little bit. So figuring out whether you are on the same page as your spouse or your partner about all this can be very important. And I think maybe we don't think enough about that, because people have different ways of coping with the idea of an illness. For some people, it might be a coping mechanism to just believe that there's nothing wrong with their child. Yes, they got diagnosed with type 1 diabetes. That's perfectly fine, wonderful. Let's take care of them and move on, right? And for the other partner, it might just be, this is not as simple as that. We have to think about so many different things about this illness. We have to take it into account while doing so many different things that it will become kind of personality changing or life changing for them. And then there can be a chance of resentment building between the partners. Like, why do you always have to bring in this illness whenever we talk about something? Why do you have to limit our child and his potential by bringing up this condition all the time? And parents not being on the same page about how they're thinking about this illness, the terms that they're using, the mindset they're using when they're thinking about the illness in itself and its treatment. And honestly, I think if that is the issue, it can become very dangerous in some ways for the child to see that the parents are just going into completely different directions. Who should the child really be listening to? Is the one parent who's being overprotective? Are they coming in the way of their goals and their happiness and their future by being so kind of overly protective and always identifying them as somebody who's having type 1 diabetes is more than anything else that this child has in them, right? Versus a parent who's sort of like, this is just something that we deal with, but let's not make it the center of everything. And I think there has to be a balance between the two approaches, right? So at what point do you all sit down and talk about this or discuss it? Do you consider family counseling or therapy to really become on the same page with regards to all these conditions? I think that's something that is not probably talked about as much, but it's very, very important in the well-being of the child. Figuring out, what school they'll go to, if that school is good enough in taking care of them, do they understand what type 1 diabetes is, how they need to be taken care of, sleepovers, out of town trips, and in relationships in general, right? Do your family and your friends understand what this is? Are they kind of treating your child like somebody infected with an illness and kind of, staying away from them, or being overly concerned about them or under concerned about them? You feeling a degree of resentment or annoyance or frustration around family and friends, feeling like nobody understands this, nobody gets you, nobody gets your child, and you're in this alone. I think that can be very daunting for a parent.
Yeah, that's so true. And again, all of those, I think we all experience. I want to step back into when we're discussing children's reaction as they get older. And, in some cases, and I hear it in diabetes medical conferences that, an older child may go through a period of rebellion where they're just fed up and they're done with it. What strategies would you suggest that as a parent that we might consider that might help, because we don't want to become nagging to our children all the time. They're probably already feeling that we're doing that. What's your blood sugar? What's your blood sugar? You know, now my son answers, I'm like, what's your blood sugar? He's like, if it's close to dinner time, he'll say something like, it's hungry, or it's happy, or it's tired, and without just wanting to check it and look at it. And I understand that. So I don't get terribly upset, because I remember that this is, you know, such a big thing. But let's say like he was just not taking care of himself, then what would a parent do to try to motivate their child to come back into, you know, understanding that this needs to be taken care of, even though it's challenging?
Yeah, yeah. So I think really the first step is communication. And communication is a two-way process. You cannot expect it to be a one-way process. You cannot just expect to ask your child to tell you how they're feeling or why they're doing what they're doing when you are not talking about your feelings and emotions with them. So from the beginning, being very open with them, talking about feelings and emotions, you know, figuring out why they have a loss in motivation, why they're not doing the things they were doing before. And talking to them about it, you know, has anything changed? Has anything happened? If we're talking about teenagers, you know, is there something going on in school with their friends? Is it a relationship issue? What is going on? A lot of times it will be something external to their condition. It will be, you know, something social, something related to friends or school or something. So figuring out, and like we talked about in the very beginning, that even if the stress is external, something else going on, it will affect how they're taking care of themselves and their treatment. So really being very open in communication and asking children how they're feeling or what's going on would be important. And then recognizing the signs of something more serious or deeper. Is it that they're becoming depressed? Is it that they're burnt out? And is it time to get them help? You know, would be important as well, because we can talk to them all we want, but if we're constantly finding out that it's not helping, then it would be time to move ahead and consider getting them help. Sometimes incentives work for children, you know, so not necessarily making it about if you keep your blood sugars controlled, then you'll get this, that, or the other, because really sometimes it's not even in their control. But you know, making it's something based on incentives can be one idea, maybe for younger children to make it work. And then I think another part that as parents we might need to look into would be, when do you step out of your that zone of I need this under my control, right? Especially if you've had a child who was in a very early age diagnosed with type 1 diabetes. You've been used to being the only one who manages it, controls it, makes sure that, you know, things remain under control, and it can become difficult for a parent to give up that control, to rely on the child and his responsibility, and that maybe it's so. I think for parents that can be something important to recognize as well. Am I being too nagging? Do I need to step away a little bit from the management of diabetes that they're doing for themselves now? Do I need to trust them more, right? So I think, again, and communication would be important in that, asking your child, do you feel like sometimes I am too nagging, or I push you too much? And let's talk about that. How can we make it work such that I don't have to ask you so many times, and I'm reassured that you're taking good care of yourself?
Great, thank you for that. Yes, all of those. And as someone with a child that was diagnosed at a young age, letting them kind of start taking control and sending them out to do things in the world, yes, there's a certain amount of fear there, but I can say from experience, if it's helpful for anyone, that it's not always perfect, but I'm glad that we're doing it, because I hope that it just prepares him for the future and makes him feel a little bit better about it, and things like that. And then another thing that you mentioned is relationships and the questions and things that come from people. And especially in the beginning, they're so hard to answer because we don't really have all the answers ourselves. We still don't. And then we're trying to just learn. At the same time we're going through the grief cycle, we're trying to learn about the care, because you have to start becoming a kind of pancreas immediately for your child and learning how to do things. So those things that when, you know, people are asking questions, and sometimes they're genuine questions that we may not have the answer for, or that they might, misunderstand. The questions where they just may, they may misunderstand what diabetes really is, because maybe they're thinking that it's just like type 2 and it's so easy. And I know I've had some outrageous comments, some genuine comments, people telling me that they could cure diabetes with meditation. Someone asking me, why don't I seek out alternative medicine, and what I was afraid of. And sometimes I'll answer those questions. I think I answer them well. And other times I don't answer them well, because I answer them, maybe I'm not polite about it. And I just look at them and I say, this is deadly.
Mm-hmm.
And they're shocked at my answer. So how would you suggest, when we get kind of unsolicited advice, that what can we do to deal with that? Because especially also if our children are with us and they see our reactions, I think that's also an important thing for us to be aware of.
Yeah. I think, obviously the ideal way would be to always understand the other person's perspective and know that they have no background in this, they have no knowledge, and maybe it's coming from a place of unawareness and not being educated about this illness, right? But easier said than done. As a mom, of course, there's bound to be emotions about all this, right? So for somebody to be suggesting something outrageous or making a comment which doesn't sit well with you, there might be times when your response is something that in hindsight wouldn't have been an ideal response. You might say something in frustration or in anger, or you might want to put them in their place, and that's fine. Honestly, I think there's so much judgment involved in all this that we do for ourselves some of the times, about being the kind of parent that you're supposed to be, about feeling like, why am I getting tired or stressed, or why can't I handle this? A parent is supposed to just be a super parent all the time. It should come naturally to them to never be tired or resentful or angry about anything that's happening with their child. And then with others, they bring to that a host of other people who are asking you questions or giving you advice and whatnot, and there is only up to a certain limit that you can be patient and understanding and thinking from the other's perspective, right? There will be days when you can do that, and there will be days when you can't. If you've already had a very difficult, terrible day, and it ends with somebody having this conversation with you, I think it's perfectly fine to be angry or frustrated sometimes, and to forgive yourself for that. Yes, maybe if there's a chance to educate someone, you could do so, but you would not be in the mood of educating people all the time, right? There's always opportunities. The same person, maybe when the next time you meet them, you can be more patient with them. But if once in a while that does happen, it's fine. Please forgive yourself. I think that's the most important. Not judging ourselves for the way we react. Yes, ideally, when our children are with us, there has to be this sort of image of everything is under control. We are good with this, but we all know that that doesn't always happen. And for children to see that parents can be angry or frustrated, and then they can talk to them about it and say, hey, did you see how, I can answer that lady and I got frustrated. Maybe I shouldn't have done that, but that's how I felt at that time. And, I wanted to talk to you about it. I think that's key. Whatever happens, you being able to communicate about it and talk about it and ask them, how did you feel? Did you feel like I was getting angry because you have this condition? Or did you feel whatever, you talk to them about it and reassure your child that it's never about them. It's not about them. And you are a human and you have feelings and emotions. And sometimes, you can be angry.
I love that, talking to them about it, because then I think that opens up so much communication between you and your child too, about the subject. We just got a question that's actually related to relationships, and I think it's really important. So thank you for asking this question. My son refuses to tell teachers about his diabetes because he thinks they will treat him differently or will be worried about him in front of his friends. What is your advice?
Yeah. I think that's a very good question. And I was wondering about that when, when I was kind of thinking about this topic, that how much of a secret it should be kept versus how much how openly do you talk about it. And compared with other maybe disabilities or other chronic illnesses, I think it's a little bit different with type 1 diabetes, because it's not just about with any other illness. I might say that it's really between you and you, what you decide to do with the information. If you don't feel comfortable, keep it to yourself, right? But I think especially with type 1 diabetes, there's a safety element as well. When children are around in an environment where they have to spend prolonged amounts of time, it becomes about their safety as well. Do people around them know what they would have to do if a crisis situation occurs? And also keeping a secret can be so burdensome. So having this discussion with your child, and again, what are the parents doing? Are they keeping this a secret? Are they telling all their family and friends about it? Or do they prefer to not talk to people about it? So I think this is something that as a family should be discussed. What are the pros and cons? And if as a family you decide, no, it's always better to be open, it's good for your safety, it's also good for you to, just make it a part of your identity, not somebody who's sick, but somebody who has to live a little bit differently at times because of this condition, and be totally open and okay with that. And it might be less burdensome for you. But if, depending on the child's personality or the way the parents are, if they like to keep this within the family or not tell people unnecessarily, then that's something that they, again, have to have an open discussion about. How do we treat this diagnosis? Do we keep it to ourselves? Do we tell people? If we tell people, are we telling everyone, right? Or only the people who are necessary to be told? So I think these are things that need to be discussed. And if a child is hesitant to do it, then talk to them about it and understand where it's coming from. Does this have a deeper meaning? Is it just about the diabetes, or in general, do they feel like they're different from their peers? And sometimes it could be so many other things, right? Teenage is not easy in itself. So figuring out and maybe normalizing the diabetes at some points as well, that, maybe educating their friends. I don't know how this can be done, or if parents do that, but inviting people over, parents or families or kids, and maybe giving them a little talk about diabetes and saying, hey, if you have any questions, ask me, I can explain. Doing that for your child to facilitate things for him.
Yeah, and I can actually kind of speak to that, because when my son was really young, I wasn't really sure what to do for that about telling other children at school. I for sure wanted his teachers to know, because again, as Dr. Khan pointed out, it's a safety issue. It's important that they know so they can recognize high blood sugars and low blood sugars. And we're going to talk about those things actually in the school session coming up next week. But when it comes to friends, sometimes when I speak with other parents of children with diabetes, their child is an introvert and maybe doesn't want anyone to know, or it's new and they feel shy about it. And again, because my son was so young, I remember there's some books out there that are really good, actually, that you can, that are designed for younger children particularly. And I gave one to, I think it was in like the first grade, to my son's first grade teacher. And I said, well, maybe we can talk about reading this in the future. And then she just went out and like read it with the whole class. And I was so terrified. And I thought, oh my gosh, what are his, I was thinking this, I didn't say it, but I was thinking, what are his friends going to think? And she was like, no, it went really well. Young children tend to be a little bit more accepting sometimes than adults, it seems, in my experience with diabetes. So with a little bit of encouragement, and maybe sometimes like some parents like to go to the classroom and they might do it for International Diabetes Day, and then they talk about different types of diabetes or do a little activity with the children, and then it just really opens up the discussion. And then after that, it doesn't become such a big deal. That's not always the case for everyone, but this is kind of generally what I have found. But that is such a big step. And like Dr. Khan said, again, it's going back to the communication. And also I think culturally, a lot of cultures talk about diabetes differently in children too. And I think that's super important, what you decide. So more questions are coming in. So
I have one thing to add. It's actually very interesting that when you reached out to me, in the same week I was watching this show with my daughter. It's called Babysitter's Club,
oh
and
yeah.
it had one episode about type 1 diabetes, and I found that very interesting. And maybe, that can be one way of introducing it to other children, TV shows, or like you said, a book, something that they can easily understand. So I really like that episode. And if parents haven't watched it, I would recommend them to watch that.
Yeah, we had a chat about that in the group. I actually haven't even had time to watch it yet. And I think kind of the discussion, some people said some mixed things about it. So I'm curious to see why. But it's always great to see type 1 diabetes properly represented
Mhm.
in a TV show or something, because it just kind of opens things up, like you said, and then people can really talk about it. And also the other thing I wanted to point out, because, you know, the words like, disability and disease and condition, and our kids hear that and they think, oh my gosh, I'm different.
Mm.
And I tried my best early on to teach my kid that this is kind of a special superpower almost, because you have access to health. And I mean, it sounds a bit advanced clinically for a small child. I said, but you are going to know more about yourself than what your friends know. Over time, you'll understand that better and more about your health. So I try to tell the story in a different way, that it's not something that holds you back or makes you different. It actually makes you stronger.
Mhm. Absolutely. I think rather than them to feel like it's a defect of some sort, they have to, if it's done in a positive way, I think that's wonderful. At the same time, though, I think what this can come in the way of, and like we were discussing about parents' coping mechanisms, right? They want so strongly for their child to believe that this could be something positive, that it doesn't mean it really limits them in any way. And if they use this coping mechanism very, very strongly, and if the child at some point starts struggling with that idea, and start saying, no, I know this is an illness and I know this does limit me, can we just be realistic about it? Can we talk about that? Let's stop pretending like it's a superpower. For the parents then to be okay with what direction their mind is going into, and dealing with that. I think that can be quite important as well, being flexible with how their child is feeling and addressing that.
Right. Supporting them where they are, not saying, oh, get over it and move on. Having, I guess, empathy, right? And
Absolutely.
trying to be understanding, because I don't know what it's like to have diabetes. So if my son's, having a difficult time with it, then for sure I need to support him where he is. And as much as I want to try to pull him along, then that becomes really, challenging. Here's a question from Zaina. This is a very good one. How can a type 1 child be able to reply back to other students when they keep saying, and this is the student saying, they can't eat a certain treat because they have diabetes during class time? There's a very popular meme that says, type 1s can eat everything but cookies laced with poison, kind of thing, because as long as you're covering your carbohydrates,
Hmm.
insulin, then you can eat it. Now, you might get better outcomes the healthier you eat, but this happens a lot. So students are aware of the condition, but they just might think no treats are allowed, and then it becomes embarrassing for the child, because people are always kind of food policing. And I say food policing, but in children, that's not really the case. They're just like, oh, you have diabetes, you shouldn't eat that. Then that becomes embarrassing and shameful for the child with diabetes. So what's the best way to approach children who really don't understand that in general?
Right. I think, again, going back to education would be important, because these children probably have no understanding, right? The kind of diabetes they've heard about or seen in media or with their family members, there is this belief that food restriction is important, and certain kinds of foods or snacks should just not be allowed. And then of course we're talking about kids. There will be some kids, even if this weren't diabetes, who will try to find a way to pick on a child. So maybe there's an element of that. So I think if this is becoming a recurring problem with a certain child or some children, then maybe the teacher needs to be involved, so the teacher can educate them that not to be picking on a child particularly because of this because of them having type 1 diabetes, right? But if this is about education, then like we talked about, whether it's the teacher who can explain, whether as a parent you can maybe educate these children, go in. There's so many opportunities where parents can make use of that. There are, like we talked about, there being a diabetes week or a day where they can go in and talk about these things, where they can explain how it doesn't matter what they're eating, or you know, again, getting in, just like for any other problem, you would be getting in touch with a child's parent and explaining to them, can you please talk to your child about this, that, or the other. So I think it really comes down to understanding where it's coming from. Is it really a matter of them not knowing about this? Are they just being mean? Are they just bullying the child? Or what is going on? And take it just like any other thing. Like, you know, if this were a gender identity issue, a sexual orientation issue, anything else, is this coming from a place of a child being unkind? Is it coming from a place of them not being aware? How do you approach it? So I think, again, communication and education will be important. I don't know if you have something to add to that.
No, for sure. That's definitely so much of diabetes. After we learn the medical things that we have to do is communication and education, and sometimes saying the same things again and again to different people, to the point where, you know, you might get tired of hearing yourself say it, and you might think people may not be listening, but they do. They are. So definitely, as Dr. Khan suggests, communication is the key. And people are commenting that it's easier with younger children than with older children, which for sure we talked, as you get to be a teenager, that can become so much more challenging. And again, similar, so much, you know, around relationships and young children and friends and school. And Sarah has an 11-year-old daughter who will be joining a new school this year, and she's worried her classmates will be with her once, you know, about how they will be with her once they learn she has diabetes. So what would you recommend would be the best way to help her cope with this new situation? And how would she educate her classmates about having diabetes at 11? Adolescence, that's a pretty tricky age to begin with.
Yeah. I think, again, it's going to be important for you to talk to her about this thoroughly, right? Figure out how she's feeling, why she's feeling the way she's feeling. Joining a new school can be difficult in so many ways, right? So addressing all those concerns and then asking her how she would like to approach this. Does she in the beginning not want to tell her friends? If so, why, and what are the pros and cons? Does she sort of want to announce it as soon as she goes in? Again, the pros and cons, making lists with her, figuring out why she wants to do what she wants to do, and then saying, hey, if you have your own a strong opinion about it yourself, then maybe explaining it to her, then saying, but you know, I leave it up to you. You think about it, because this is the age where they want to do things, they want to make decisions, they're forming an identity. So giving her information, all kinds of information, and then saying, hey, think about it and make an informed decision. You've made your list of pros and cons. If I tell people right away what's good about it, what's bad about it, if I take some time, if I only tell close friends once I make close friends, think about all that. Do what makes you comfortable, because at the end of the day, they have to go into school feeling comfortable, feeling like there's not something so heavily weighed upon them that that's the only thing they can think about. They need to be excited about the new school. Yes, they will have some anxiety and some kind of fears about it, but this doesn't have to be the only fear.
Great. So, this is a good question. Any advice about siblings and how much attention goes to diabetes? And how much would you like to see support in the family ideally? Because that can happen a lot. The child, if there's multiple children in the family, the child with diabetes is getting all the attention, or the condition gets all the attention. And then the other children feel like, you know, they're maybe overlooked because everything is often all about diabetes.
Right. And this is a very important one. In fact, I don't know how I forgot to mention it, but I think in the family dynamics, this can be something extremely important for the emotional well-being of the child with diabetes, as well as for the emotional well-being of all the other children, because it is important for them to not feel neglected. as well as for them to be supportive to their sibling who's going through some difficulties themselves. So as a family, again, I cannot lay enough stress on communication. As a family, talking about this with all your children, individually and as a group, right? So if there is a child who's being extremely difficult, then you talk to them individually. You ask them how they're feeling. Something that, I find now very humorous, but at that time, when I had my second child, I remember my daughter developing a stomach ache, right? And nothing that I did helped her stomach ache. So one day I sat down with her and I said, hey, we've tried to figure out everything that could be happening. There's no reason for you to be having a stomach ache. Are you feeling neglected? Because we had another addition to the family. And she said, yeah, I think I feel neglected. And we talked about that and everything. And to this day, she's almost 10 now. Every time she has a stomach ache, she says, but I'm not feeling neglected. So it's so it's really funny. Now she thinks stomach aches are only a result of feeling neglected. But I think what I want to say is you talk to children about why they're feeling the way they're feeling. If they're being mean to their sibling with type 1 diabetes, you talk to them about it. You explain things to them about why you have to give them more attention, right? And maybe between the two of you, between the two parents, you give that other child additional attention for some time, so they start feeling like, hey, no, my parents do understand where I'm coming from. It's not easy. There's no perfect solution. It's going to be a struggle. It's going to be hard, but there are ways around it. And the more you talk to your children, the easier it's going to be.
Yeah, that's really true. I even know some parents with multiple children that they'll kind of, make different special dates with each one individually when they can, especially if, things have been ramping up a lot in the diabetes space, so to speak, that it's been really busy. And that also seems to help and gives you time to communicate one-on-one, not just kind of in between the things at home. So that's a strategy that's worked for some parents. Katie has said, one thing that is difficult for most adolescents is feeling normal, even in the absence of diabetes, especially in adolescence. One thing that may help is helping the person with type 1 figure out what helps them feel more normal, and having a peer group of people who are like them. The level of social unawareness of different types of diabetes can certainly have adverse effects on individuals who live with the condition, isolation, stigma, discrimination, etc. Consider helping them find a community of people who are also living with the condition to have a grounding point of common experiences. That is just absolutely spot on. And, that's one thing that I'm all about trying to create, and COVID kind of kept us from seeing each other in person. But no matter where you are in the world, and with the internet, you can find other people with diabetes, other children with diabetes, adolescents with diabetes. It's important to feel not alone and connected. I know my son went for years here before he saw anyone with type 1 diabetes. And so kind of the first time he got to connect as a community with some, it really was very impactful and made a difference. So thank you for your comment. Another question just came to me. How much can anxiety and depression come up for kids as part of the condition? And I think this kind of leads to my next question for you, actually. When should we, seek out help? But there's more to the question. So how to diagnose this as a part of diabetes distress versus regular life? Do you have any advice how to perceive stigma? Is there stigma of type 2 one can show? So that's a lot of questions, but all super important.
Yeah. Right. Yes, I think it's important to recognize when it moves on from becoming, just the stress of having a chronic illness to something more serious, and when is the time to get help. I think it's important to recognize those signs and symptoms. Major depressive disorder is something where you experience prolonged and persistent low mood. There can be a decrease in energy. There can be impaired concentration. lack of appetite, not sleeping well, and especially in children, something that happens can be social withdrawal. You might notice them not engaging so much in social activities, becoming withdrawn from their friends. They might become more irritable, might become more angry. You might see that as, you know, just a change in their personality, but that could be depression. And also their academic performance being affected. So if they're, you know, a child who was doing very well in school, all of a sudden you feel like their grades are not so good anymore, then those might be some of the signs of depression, right? And when does depression become a disorder is, you know, when it starts affecting your daily activities, when getting out of the bed is becoming difficult, taking a shower is becoming difficult, you're not doing the things that you were doing before, your child seems like a different person, when their relationships are being affected, and when basically this low mood is coming in the way of life. And when it's persistent and prolonged, that's when it's really becoming a disorder which needs to be treated, which needs professional help. So I think it's important to recognize when maybe a child is just going through a phase or feeling demotivated versus when they're actually going through an episode of a major depressive disorder or severe anxiety. And sorry, what was the question about stigma? I didn't get that.
Going back to stigma, do you have any advice on how to perceive stigma? Is there stigma of type 2 diabetes that people with type 1 can show? Like for example, stigmas. So many people think with diabetes of any kind, because they all think of type 2, if I understand the question correctly. If not, please correct me. So with type 2 diabetes, people think the reason you have type 2 is because you just didn't take care of yourself, you ate the wrong things. I was told that I must have had too many sweets when I was pregnant. You know, that's not a type 2 thing, or that, you know, it must be related to, you know, obesity or other things like this. But that, okay. She says like, oh, my child doesn't have type 2 diabetes. That in itself is its own stigma, because type 2 is considered, you know, there's a lot of blame and shaming of the person with type 2, I think. With type 1, you know, people often they ask like, oh, is that like the bad one? So there's more of a stigma that you did it to yourself with type 2 than type 1. So
Right.
the question, do you see, you know, that, or what is your general, you know, opinion about that?
Again, I think there has to be a certain way of dealing with all these things. Whether it's type 2 or type 1, there shouldn't be a stigma, ideally, right? Nobody wants to be sick. Even with obesity, yes, there's a blame and shame and all that, but there are certain things that are not in anybody's control. Nobody wants to be living a difficult life. Nobody wants to be living, be constantly struggling or not feeling good. So I think there needs to be that respect. And if somebody is not doing that, again, figuring out whether it's coming from a place of not being aware or a place of judgment or just a place of unkindness, you decide and you respond the way you think is best. But yes, absolutely. I think no, there should never be any stigma associated with any illness, because nobody wants to be feeling sick, and dealing with the burden of stigma can be so daunting, right? And again, with the stress or the depression and anxiety, there can be, again, so many more stigmas. So I think as a society, we need to overcome the stigmas. Even if somebody has a perception, either you can educate them or you can choose to ignore them, or, you know, however you decide to deal with people. But I think what's important is for us to not have any judgments within ourselves. That's the place to start, and to educate our children and people around us and people that we care about. We cannot change the whole society or the world. So I think there has to be a certain degree of ignoring people and not really paying attention to what they are saying, because
Yeah, I agree. And I even, as you were talking about that, a child a few years ago in my kid's school actually said something to him about diabetes and said, oh, well, like, and he made kind of this comment about type 2. And I was really so proud of my son, because he actually stood up and said, you know, all diabetes is bad. And we're like, yeah, because, you know, people think, and we then talked about it, like you said, communication. We had this really deep conversation about it, that nobody wants to have diabetes. So it's really, you know, nobody's fault. So we are like 2 minutes from the hour, and I don't want to run over. And are there any other questions that anybody would like to ask very quickly, or follow-up questions? If you think of something later, please send it to me. I'll send it to Dr. Khan. I can share it. We're just really so grateful that you were here. I could sit here and continue to talk to you for another hour, but I'm sure you have other things scheduled for your day. Thank you so much for being with us. It was really a pleasure, and I think everyone's now comments are starting to come in saying thank you so much for your time and giving us so much insight and advice to what we can do to help our children, manage life with diabetes, and to help ourselves as parents and caretakers with diabetes. And I just want to say thank you to everyone that's joined. I think this is one of the most crowded virtual sessions that I've done yet. So it's great to have everyone here. And for those that have registered, and if you're local, so I'm happy to say if you're in the UAE, Dr. Khan is based in Dubai. If you want to get in touch with her, please let me know. I'll send you how you can reach out to her at the clinics where she's working. We're very lucky. And one thing that Dr. Khan, when she was talking about when it's time to reach out for help, if you need help, please do not be, or I should say support, please do not be ashamed or worried to get support. I'm really happy to say that having been in Dubai and the UAE for over 15, maybe almost 16 years now, we have so many more options of places where we can get support, and that can make just a huge difference in your life, your children's life, the life of your family. So do not be afraid to ask for help when you need it. And for those that have registered, as I mentioned before, at the end of all of the sessions of the virtual picnic, I will be sending you a code for 50% off of all the cool stuff we have in the Diapoint shop. And one lucky winner will win a case of our Pro Youth Nutrition Bars, which is our newest, most exciting product that we have. I'm so excited about these because they're 100% natural. They were created by a mom that got tired of seeing her children eat junk food after sporting events. It's got dates, it's got nuts. I'm sorry if you have a nut allergy. It's mostly cashews and some whey protein. There's no additives. And I met this woman virtually, and I fell in love with her mission, because just in the way that we care for our children with diabetes, she's caring about the nutrition of all children. And I find these have been really great for my son, who's very into sports, and it's a great snack. So I want to share a case of those with a lucky winner. So thank you all again so much for joining. And this Thursday morning coming up, we will be speaking with Dr. Nandu Thalange. He will be talking to us about everything sports and diabetes. So I hope to see you all again then. Thank you so much again for coming. And thank you again, Dr. Khan. Have a wonderful day, evening, morning, wherever in the world you are. Thank you so much.
Thank you, Pam. It was a pleasure.
Thank you. Bye-bye.